hard to call it. It's only been around about 3.5 weeks, but the point of the RRC is to be a multi-departmental city team here to support Burlingtonians through the COVID-19 crisis. We're here to get as many Burlingtonians as much help as possible, as quickly as possible. And one of the ways we're starting to do that is through these webinars on topics of urgent and important concern during this emergency. Today's topic is mental health and addictions during COVID-19. These are challenges for many in our community, even in ordinary circumstances. And the upheavals and the stresses of the last few weeks and really over a month now have made this even tougher. And we know that, and we're hoping that this webinar will help you or your loved ones if you're concerned about your own mental health or the mental health of others. And we hope we can, the discussion and then resources that we make known on this webinar can be helpful to you and bring some relief in the days and weeks ahead. I do want to point out that the Recovery and Resource Center is an online resource that is there to help you at any time. Just go to the city's webpage, City of Burlington's webpage, and you will find links to many resources and the opportunity for one-on-one consultations on a wide range of topics. Resources and harm reduction for people struggling with substance use disorders, and in particular, opioid use disorder has been a real focus of mine and the city's for years now. And I am very thankful for the many partners that we've gotten to work with in that effort. And a lot of them are here with us on the panel today. It's a great panel, very talented people. So I'm going to turn it over to them and get out of the way. I think we have Anthony Jackson Miller, who is our parallel justice specialist with the city's Community Justice Center, who is going to take it over from here and moderate the rest of the event. Anthony, are you able to take it away?
I am, sir. Thank you.
All right, great, Anthony. Thank you.
So welcome to all of you, and thank you so much for joining. We know that there are folks all over the state who are joining us today, and we're grateful that you made the time. My name is Anthony Jackson Miller. I am a victim services specialist for the Burlington Community Justice Center, which is a division of the Burlington Community and Economic Development Office, or CEDO. And we're currently, I am currently serving as the mental health lead for the Burlington Resource. The Burlington RRC is the City of Burlington's response to the COVID epidemic that seeks to help people get resources that they need through a call center and a website that is updated daily. We launched on March 23rd, and we're currently comprised of 38 staff members from 6 city departments. Today, we are launching a new concept for a series of virtual town halls on emotional and mental health topics. We know that the scale of the economic, social, and health disruptions caused by the pandemic are not only unprecedented, but will have visible and hidden impacts on our emotional health and well-being for years to come. I want to give the attention to these impacts by drawing on the wealth of community resources that existed before the pandemic, as well as hearing from you, the community, and what you need during this time. Today's focus is on the challenges of mental health and addictions. Future topics will include how families and youth are coping with mental health challenges during COVID, as well as mental health and wellness for veterans. At the end of today's webinar, we will give you more information on how you can share your ideas for additional webinar topics. So with further ado, I'd like to introduce today's topic, mental health, substance use, and addictions, and our moderator, Jackie Corbley, High-Risk Behavior Operations Manager at the Burlington Police Department. Thank you, Jackie, for joining us.
Hi. Thank you, Anthony. And I want to take a moment and welcome everyone who is partaking in this virtual town hall. We in the city of Burlington and surrounding communities recognize that we are in the throes of a pandemic that none of us have experienced before. And with that pandemic are coming many concerns surrounding mental health and addiction. We brought together 3 experts in our community today to really talk about areas of concern. Today's virtual town hall is really for you, the public, to ask us questions on feelings, emotions, and behaviors that you or a family member or friend might be engaging in that are causing you concern. It's also to acknowledge resources that are potentially in the community for you. We want you to know, as a mental health addiction community, we are open, we are here to provide services, and we are concerned. So without further ado, I would like to acknowledge the three speakers that we have brought together today. First, we have Gary DeCarlos, who is the Executive Director of the Turning Point Center in Chittenden County. Gary is an expert in the world of recovery and runs the center that is in Burlington and has done so for a number of years. Grace Keller is the program coordinator for the Howard Center Safe Recovery Program. Not only is our needle exchange, but is also a low barrier buprenorphine site that we are quite proud to have in our community. And Grace will be here today to answer questions in regards to not only addiction, but access to medication-assisted treatment services. And then lastly, but by no means last, Dr. Bernstein, who is a medical doctor, psychiatrist, who has been engaged in the world of mental health for a number of years. And we are lucky that Dr. Bernstein was able to be with us today to answer those mental health concerns, all the way from I'm feeling overly anxious, I might be feeling depressed, etc. So without further ado, I'd like to turn it over at this point to Gary to just kick us off with a few opening remarks about the world of recovery.
Thank you, Jackie, and thanks for the opportunity to be here today with all of you that are out there listening. The enemy to recovery is isolation. And we've kind of, in our world, we've reframed this whole isolation that we all have to go through, given the pandemic, to a physical isolation, but it doesn't mean that we can't be socially connected. And that's my message today, is that although we're all separated physically, there are so many mechanisms to get you connected to people and meetings and activities that can keep your recovery moving forward. Let me give you some examples of that. So we have here at the Turning Point Center of Chittenden County from 9 o'clock in the morning to 5 o'clock in the afternoon, every day of the week, including weekends. We're available by phone at 802-861-3150. If you call us, we'll be able to offer you support and connect you with people within the center that can give you ongoing support, from recovery coaching to peer support specialists to a variety of activities that are on Zoom, the Zoom platform, and can keep you connected with people that are in the same situation as you and moving forward. We also have a website, www.turningpointcentervt.org. And there we have all kinds of resources that are available, from recovery community yoga programs that are on Zoom to our AA, NA, MA, CA, 12-step meetings that also are on Zoom platform. We have a button that's there to expedite getting a recovery coach. You just have to hit the button, put your name and phone number on there, and we'll be calling you shortly to set up a recovery coach for you. The point being that there is no reason why you can't feel connected during this time of physical isolation. The thing I want to say, that folks that feel anxious or should I make a phone call, I really beseech you at this point in time, in this unique, terrible situation, to push yourself to reach out. Make that phone call. If it's not here to the center of charity, a friend, or maybe when you've met the faith community, but do whatever you can to call that person. You're not only helping yourself, but you're also affording someone else the opportunity to help you. And it's likely that someone might end up calling support too. And this is how we knit a sense of community while we're not able to be there physically together. And it's very important right now, both, as Anthony said, both on the substance use and recovery side of things, but also for your own mental health. We need to feel like we're part of something bigger than ourselves. And so along with that, I would also say, get out and take that walk. Get that body moving one way or another, but keep busy, keep connected, and know that we're here for you.
Great. Thank you very much, Gary. One of the things that before I pass this off, I'd ask that if you are not speaking, if we could mute ourselves so that we could keep the feedback lower. Anyway, at this point, I'd like to introduce Grace Keller, the program coordinator at Safe Recovery Howard Center program, to really just talk to us about medication-assisted treatment services and access. Welcome, Grace. And you are muted, Grace.
I followed the instructions too well. Hi, thank you so much for having me. I'm Grace Keller. I'm the program coordinator at Howard Center Safe Recovery Program. We are Vermont's oldest and largest syringe exchange program, and we are the largest pilot site for Narcan distribution and overdose prevention. And we also have a low barrier buprenorphine program too. So I will talk a little bit about each of those things and what's going on during COVID. Our syringe exchange is actually still open for face-to-face syringe exchange. We have set up mechanisms to make sure that social distancing is in place and people will be accessing safely through a window. But we want people to know that those life-saving services are still available to clients and their loved ones. We are able to give people sterile supplies and also Narcan. So Narcan is the overdose reversal medication that you can give to somebody if they're overdosing and save their life. And we want to make sure that people have access to that. So we can provide Narcan and overdose prevention training right at our office. Our office is at 45 Clark Street. It's right at the top of Church Street, and Clark Street runs to the right of the church at the top of Church Street. We're there Monday through Friday, 9 to noon and 1 to 5. And people can come by and get Narcan and safe injection supplies. We also have case management for people who are using drugs, and we have a low barrier buprenorphine program. All of those have gone remote, so people can access us through phone, through Zoom, through FaceTime, and we want to make sure that people know that we're available, especially at a time that's critical, that people might be feeling at risk for relapse or feeling like they want treatment. We have treatment still available on demand. While some things have become more restricted in that we can't see people face to face, we actually have a couple more options that weren't available to people before that people might avail themselves, and it might be easier for them. We can start somebody on buprenorphine over the phone or through Zoom. So we are taking people, we have been taking people each day into treatment. So if you know somebody who's ready for treatment, who's wanting treatment for opioid use disorder, just have them call 488-6067 and we can get them set up for the same day treatment. We also can help them connect to other treatment in the community for other programs that might be more appropriate for them or for residential treatment. So we just want people to know that we're here, we're still here. Things might have changed in our delivery model, but that our hours are the same, that we're always available, and that if people need or want treatment, that they should reach out. And we're here. Also, if people aren't ready for treatment, we're also here to support them. If they're struggling, they need help, they need case management, they need housing. We just want people to reach out no matter what stage they're in, whether they're ready for treatment, whether they're not, whether they're in long-term recovery, whether they're actively using. We're always here to help. So again, 488-6067. Thanks so much.
Great. Thank you so much, Grace. Dr. Bernstein, I have heard from a number of folks that the anxiety that we are feeling from this virus and the concern when we leave our homes, even with a face mask, we hear the stories of those who are asymptomatic, who have very little concern. But then we hear these stories of people who are no longer with us, who are in a high-risk population. We are also starting to hear that the virus is taking the lives of people who are much younger than 65. So I think it would be a fair concern to say that the anxiety we are feeling as a community is pretty high. Normalcy is something that we are really struggling to identify with at this time. And the depression that many of us are feeling, I believe, is very real. So could you just talk to us a moment around these feelings of anxiety and depression and what we should do with them? How can we address and deal with them and work through, not only for ourselves, but for the ones that we care and love?
Thank you, Jackie. I'll do my best. That's a broad area. And I'd like to say hello to my fellow colleagues and panelists and to the greater Burlington community. And thank you for this opportunity to speak with you. My roles since semi-retiring from the University of Vermont have been in different areas. I consult regularly to a residential treatment facility for young adults with substance abuse and mood disorders. I'm the chair of the Board of Medical Practice for Vermont, and I'm a town health officer. So I will speak first about the public health issues of this epidemic. And let me also, as a cautionary note, say to those who are watching, the five of us look like we are all well and healthy and expert and have great things to say and much advice to give. But let me share that each one of us in our own hearts, souls, and minds have our fears and worries, and we don't have all the answers. And our hearts go out to the rest of the population who is joining this today to say, we'll give you the best advice, but we're also in it with you. To start with just Public Health 101, it really is important to wash one's hands frequently. It is important to keep social distance, and it is important out and about to cover your nose and mouth, because this coronavirus is spread by droplets, and the droplets can carry, we know, at least 6 feet and probably more. So it's very easy to dismiss these easy things, but they are important. Jackie mentioned stress. Franklin Delano Roosevelt back in the 40s said the only fear we have is fear itself. Stress contributes to the fear, and the biggest fear about this virus is that there are so many unknowns. It seems to have come out of the blue. It seems to have its own mind. It chooses its victims both with care and without care, and we don't know what the final analysis will be in terms of the comparative wellness or unhealth of our community. So there are a couple of just general thoughts that I've thought about that I can share with you. The first, and Gary mentioned this earlier, is taking care of one's body. And taking care of one's body means getting regular and sufficient amount of sleep. Most of us don't know how to monitor when we're tired or not, and often push through or talk to ourselves and call ourselves lazy if we want to take a break. But this is a time to pay attention to your body, make sure that you get rest. The next area, Gary mentioned this as well, is activity. There is such a thing as an exercise high. You don't have to run a marathon to get an exercise high. You can do any 20 minutes of cardiovascular activity that gets the heart beating 20% above its normal beating rate. So the normal beating rate is 70. If you can get your heart rate up to 90 or 100 and do that in a sustained way for 20 minutes, that is taking care of your body. The third area of taking care of your body is what you put in your mouth. For those of us who have had habitual or addictive problems, it's very common that the stress that we feel leads us to abuse both the substances to which we're addicted and to other things. We eat more, we smoke more, we drink more. It could be chocolate. It could be whatever it is that attracts us. And eating really has to be kept in mind. And the fact that if we have an underlying other health problem, whether it be a mental health problem or a physical health problem, and it's really ridiculous to separate that because we're all one body. Our mind, soul, heart is all one, and the head bone really is connected to the heart bone, is connected to the leg bone, and it does all work together. So sleep, exercise, and being aware of the quality, quantity of food that you take in is extremely important. The next is following a schedule. Some of us like to be on schedule. Some of us don't like to be on schedule. Some of us say, oh, I do what I want. But in fact, we are more animal than non-animal. And most of our creature habits are indeed habits, and they do have schedules. And that schedule is something that's known, which as opposed to the coronavirus is an unknown. So staying with a known schedule for some things as simple as personal hygiene, hour of sleep, when to exercise, when to work. And our work is variable. It doesn't mean that we are going to work to get recompense for it. Work is anything that maybe we don't like doing but feel we should do. Work is cleaning the toilets. Work is scrubbing the floor. Work is finishing an assignment. It's also important to remember that there are numbers of us who are in different occupations and different relationships, so that grandparents feel stressed differently from children. Children feel stressed differently from rescue workers. Rescue workers feel stressed differently from people who are unemployed, so that our vulnerabilities are carried with us. And we have to be mindful of what our vulnerabilities are so that we can design a protective schedule for ourselves. There's just two more things I want to mention. I know there's lots of questions, and then I will sign off. Connectiveness, as Gary said, is very important. Staying in touch with friends, relatives, loved ones is extraordinarily important. Finding a quiet place in your own mind is important, whether you do it through yoga, whether you do it through prayer, whether you do it through concentrated relaxing, through breathing in through your mouth and exhaling breathing in through your nose and exhaling through your mouth. Anything where you can center your mind, center your concentration, and try to remove yourself from the stresses that are impinging on us at all moments. And finally, doing for others, what we call altruism, is an extraordinarily powerful tool that all of us need help. All of us can give help. All of us can get help. Both giving and receiving are things that build what we call resilience. And discovering ways that you can reach out, to be generous, to be connected, is a terrifically healing way of going about one's life. So I'm going to stop there and turn it back to you, Jackie. Thank you.
Yes. Dr. Bernstein, there has been questions around young people, young kids who kindergarten through middle school, high school, and concerns around noticing these young folks are starting to feel depressed. They're not with their friends. They're not with their peer group. Do you have any recommendations or thoughts around how young people that we are living with can stay connected to their peers and the significance of staying connected to peers?
I'm not a child psychiatrist, but I do have 8 grandchildren, and they are all struggling. One of the things that I would say is not healthy is to turn to electronic devices and to spend the day doing that, because that is isolating. Everyone, all of us, regress under stress, so that even the most mature of children will adapt earlier behaviors and get to a point where we thought they had, quote, grown out of. The if we can spend increased time with kids to the point of our own limitations, because sometimes having a bunch of kids around is more than we can take. So we can say to ourselves, enough for now, guys. I got to get my head back straight. Let's meet again in a couple of hours and we'll do thus and so. So planning with children, giving them something to look forward to, modeling behavior, which is kids don't learn from what we say, they do learn from what we do. So modeling behaviors that they can assimilate into their own lives, taking care of oneself, enjoying nature, spending time, reading, sharing, talking, and try not to medicalize stress. Stress is stress, and what reassurance that can be given. Gary, you're waving your hand. Let me shut up.
Gary, would you like to respond?
Yeah, I would just, I have 3 wonderful daughters, and I know that one of the benefits of technology today is they can FaceTime each, they can a phone call friend on this isolation, being to their butt, and teenagers, that's where they get their energy is from each other, not so much from mom and dad anymore. And so having that ability to connect to a good friend every day. In fact, I tell my one daughter that just pick one friend out every day and make a phone call to them and have that connection. And it turns into a wonderful long conversation and how much they miss each other and talk about things they're trying to do, why they can't be together. So I would encourage kind of connecting again while we're physically isolated.
Thank you. First off, I'd like to just take a moment and say to our audience that if you do have a question, please feel free to submit your questions through the Q&A, and our experts will do their best to answer the questions. Continuing along the lines of young people, one of the questions that has come up is where to find the balance with gaming, where to find the balance with recognizing that this is a social outlet for children, recognizing, though, that there are those who have an addiction to gambling and to gaming, and how to find that balance as a parent. So I guess I would throw that out to the panel, but Dr. Bernstein, do you have any advice to parents about how to find balance around gaming and activities that involve peers?
I have a thought, and that is that because addiction is often accompanied by shame, and there's a slippery slope between overuse of either an object or a substance and a tendency to isolate when one is doing it, that one of the ways to bring this out into the open is that for adults, parents, to be a part of their child's gaming, and even asking them what they're playing, play with them, ask for instructions. I certainly get befuddled by some of the electronics that are out, and if they can incorporate their knowledge and share it with us, that's one way of doing it. What I find troubling is the child who goes to his or her room or away from a group and just concentrates on the electronic device. And we also know that use of electronic devices is stimulating. The light goes to the back of our eyes, to our retinas, and is a sleep deterrent. So nobody should be really using the screen for an hour or so before bed.
Along the concerns around addiction, there has been the question thrown out that I am in recovery from substances. And I find myself doing a lot more online shopping. Am I just substituting one addiction for another addiction? So I would turn that either Dr. Bernstein, Gary, Grace, who would like to answer our community member?
It's likely that that's the case, and I think they have to be just as prudent about shopping as they might be with using a drug. And so it's you can't ever let your guard down if the environment changes and what's available changes for you. That you have to be constantly aware of that within you and do things to avoid that. Limit your ability to get on the computer if you're tending to want to do a lot of shopping. That's where you call a friend or a sponsor or someone that can divert your attention and get you connected in some other ways with talking about some other things. And, even if you have to make a lot of phone calls to just get away from this, that's okay. And give yourself permission to do that. But yes, you have to be aware of a whole range of things that could, in excess, could become another addiction.
Thank you. We have another question around just feeling depressed. A community member made reference that they are feeling sad and lonely. And every day they're hearing more and more stories around COVID-19 and are starting to have thoughts of harm. What should one do if they're starting to have thoughts of harm? Is there a place they can call to get support and help?
There is a national suicide hotline, and I believe that Howard also has a suicide hotline. Most of these are personed 24 hours a day and can be very helpful. The suicide is a quick answer often to a chronic problem, and it is often a wrong answer. So if at the point of someone's becoming most suicidal, intervention is extremely important. So reach out. It's probably among the more difficult things to do because a person at a point of suicidality is stressed beyond his or her limits, and it's tough to think rationally and to do the correct thing, which is to reach out, to call, to be in touch.
Yes, Howard Center has a crisis line that's available 24 hours a day, 7 days a week, and that's for adults and children. It's 488-7777. And like Dr. Bernstein said, reach out. You can talk to somebody 24 hours a day. They'll be there to listen, to hear, to help you with referrals if you need them, and to get you general support too.
Another question we have, Grace, is in regards to Narcan. Family member has a loved one who is in the throes of an opioid addiction, and they are needing to access Narcan, but they're scared on administering. If they were to come to Safe Recovery, would somebody be able to share how to administer Narcan? And could they get Narcan to have in their possession?
Of course. So if anybody comes to Safe Recovery Monday through Friday, 9 to noon or 1 to 5, we will provide them with Narcan and provide them with how to use it. There is a tutorial also on the Vermont Department of Health's website. If somebody has Narcan in their possession and they're wanting a refresher, or they found a friend's and they don't know how to use it, it's also got directions on the box. If you're in an emergency situation, it is quite simple. It's a nasal spray, but the box does have directions on it. But one of the things we really all should be aware of is that we've done a lot of great work in reducing the overdose death rate in Chittenden County, but this is a high-risk time for overdose. One of the best tools we have to reduce overdose is making sure that somebody is not using alone and that they're using with other people. At a time where we're encouraging social distancing, we also, social distancing is essential for COVID-19, but also puts people at higher risk for overdose. So we want people to know how to get Narcan, to make sure they have Narcan available, to make sure that they know that the Good Samaritan law has limited immunity protections for people who call for help in an overdose, and that people should really call if they are worried about an overdose, if they think someone's experiencing an overdose. But we are concerned that we might see a surge in overdose because of COVID-19, and we just want people to be aware. Also, right now is a great time for people to get into treatment. Medication-assisted treatment with Suboxone or buprenorphine or methadone is the gold standard of care for opioid use disorder. And there are a lot of ways for people to be able to get into treatment right now. They could come to Safe Recovery. They can call us, like I said before, at 488-6067. They also can go to the emergency department at UVM Medical Center 24 hours a day and tell them that they need help, and they can give them medication and connect them to treatment. So the access to treatment hasn't changed. We are really able to get people into treatment right now. So if that's something people are considering, it's a great way to protect themselves from overdose. Any day that you or a loved one takes buprenorphine is a day that they're unlikely to overdose or have a fatal overdose. So.
Great. Thank you, Grace. We do have a question. Are there harm reduction based online support groups that are happening during this time?
Yes, there are. There are quite a few. The Harm Reduction Coalition is a great website. There's a Harm Reduction Works. It's out of Massachusetts, Northampton, and I believe they have online resources and a Facebook page. We have a harm reduction peer support group at Safe Recovery that's been very, very popular, and we're working to move that remotely, hopefully in the next coming weeks too. But there are a lot of resources. If you search harm reduction, there's a lot of support groups and one-on-one support. They also can get peer support if they call our office. We have staff that can do that with them too.
Gary, would you like to answer the question as well? Harm reduction online support groups?
Well, yes, we have. Go to our website, www.turningcenterv.org. See a number of harm reduction meetings and all kinds of support meetings that people can get involved with. The one I did want to mention is that we also have on our website meetings for family members who have a loved one who has an addiction, and that's a group that I know we've gotten a number of calls since this happened that they're looking for support for themselves. And I encourage them to go there. There's Zoom meetings available every day of the week and can be very helpful. The other thing that's going back to what Dr. Bernstein said in terms of our own physical health, we have recovery community yoga programs through Zoom as well. And the numbers by going to Zoom have actually doubled since what we were offering here at the center live. And so people are taking advantage of it. And I think that's important. It helps you self for a little bit, stretch that body with other people at the same time.
Thank you. Dr. Bernstein, there has been another question around, I am with my partner and it is not safe. Emotionally, how do I separate myself from a situation where I'm not feeling physically safe? What are your recommendations? I mean, I think this goes beyond the mental health concern. And I think I would answer that individual should call 911 if there needs to be services provided by your local police department. But from a mental health standpoint, is there something that you can offer somebody to take distance from a partner that emotionally is feeling pretty charged?
I wish I had an easy answer to that. In the ideal world, what I would like to think is that as tension grows between two people or among a family group, some magic will kick in that will allow a scaling down of the tension and the crisis. There is, at times of extreme, that is when we call in the DCF, when we call in the police, when we call in a third party. The secondary effects of doing that can be very toxic, not intentionally, but there's the exposure that comes from it. There's the introducing of a new personality group that escalates the tension. In a tribal family, there was always a wise chief or a chiefess who could solve problems and keep it within the family circle. I think the threat imposed upon the family system of having an outsider, even a knowledgeable one, even a skilled one, even one with the best intentions, changes the dynamic of the group. So if the first step would be is to stop. Are there resources within this immediate environment on which we can call? How can we call a truce?
Right. I think it's also important. I just want to call out Steps to End Domestic Violence, which is a fantastic organization that deals with intimate partner issues. There is a hotline that folks can call, 802-658-1996, and you can speak to a hotline worker who can help support you if calling 911 does not feel like a viable option to you. So I just want to call out that 658-1996 will put you into the hotline. And there's a plethora of trained staff that can work with you to make sure that you are safe. I also, I think that one of the other questions that we are getting is feeling that you are an essential worker and you need to go to work every day. How do you ensure that you're able to deal with your mental health? So let me reframe the question. There have been concerns that mental health clinicians are using non-traditional platforms around HIPAA. How confidential are those platforms? If you have a clinician and they are using a platform that you are not familiar with, should you still call and access that clinician? Now, I can jump in. I have thoughts. So I don't know, Dr. Bernstein, if you want to take a crack at it, Grace or Gary, and then I can give my thoughts on this.
I can take a crack at it. Well, our phones are always confidential at Howard Center, so people can definitely call. Also, Zoom platform is a confidential service that is HIPAA compliant and always has been. Zoom has been used for a long time prior to COVID-19. We were already doing, at Safe Recovery, we were already doing appointments over the Zoom platform. So Zoom is HIPAA compliant if you're talking to a clinician or somebody in the mental health world or addiction world. If you're talking to somebody at Howard Center on Zoom, you're on a HIPAA compliant, confidential video chat or audio chat. So, confidentiality is something that's incredibly important any day. It doesn't, COVID-19 doesn't change that. It also, in many ways, it makes it more important. We all are finding different ways to make confidentiality work when we're in the same home as other people, when we're in the, but your clinicians, your mental health support systems, your people who are working in medication-assisted treatment programs are all obligated to maintain your confidentiality and to work in platforms that are HIPAA compliant. So you can trust that if you're talking to somebody from Howard Center or another place, another designated agency or program like that they're HIPAA compliant. It is something that doesn't change at all in this environment, and in fact is something that's the first thing that we all consider after safety. So making sure that everybody's safe, but making sure that confidentiality is maintained. Our syringe exchange also is still and always will be anonymous.
So I think I'd also like to just put in there that the purpose of today's town hall is to let folks know that they're not alone and to please access services. If you are somebody who is in the middle of a relapse, if you are concerned about an addiction, if you are feeling overly anxious, depressed, if you are having suicidal ideations, a number of things, we would like for you to reach out and get those services, including mental health supports. If you find yourself the clinician who is using a platform and you're just not sure of that platform, we would encourage you to have the conversation about confidentiality and around what is safe to share and what is not safe to share. Most importantly, we do not want people to not get support because of a fear of a platform. So reach out and talk to whoever your clinician is around what are they using and where is that information going. We did just get a question around how do you deal with somebody who is refusing to self-isolate, refusing to wear a mask, and really thinks the virus is fake news. How do you have those conversations with somebody? You yourself might be feeling anxious over a loved one going to the grocery store not wearing a mask, or feeling like this is no worse than the common cold. So does our panel have a response to our community member about how do you address that question and thought and concern?
You know, I do a reality check with them, turn on CNN and look at the box on the right-hand corner that says 31,000 people have died. Over 500,000 people will have the virus across the country. For 1 million in the world, keep changing every minute. And if they're still choosing not to stay safe, they're basically harming everyone around them. And so that's somebody that you don't want near you. I mean, they're really potentially could be putting other people's lives in jeopardy by their unwillingness to even take a hard look at what's going on around the world.
I think
we had another.
Sorry, Jackie, go ahead.
No, we had another question. I'm aware of the time, and this I thought was a great question. Individuals on Suboxone and for a variety of reasons cannot get to the pharmacy to get the medication. Is it possible for the pharmacy to mail Suboxone to the individual who is in desperate need of their medication?
I don't know that they can mail, but what I do know is that a lot of pharmacies are doing delivery. So people are accessing their medication through delivery services. So if your pharmacy doesn't deliver, you might reach out to a different pharmacy that's close to you that would. I do know that a lot of our clients have availed themselves of that service. Also, if you have a safe person that can pick up your medication, somebody with an ID can pick up your medication and bring it to you. But I would encourage people to make sure that that person is safe, to make sure it's somebody you know, a friend, a family member, a trusted person, because those are essential medications. They're life-saving medications. So you don't want just anybody picking up your prescription. But but there is a delivery service at most any pharmacy, and people are really working hard to make sure that people have their medications.
And
great, thank you.
2 pharmacies in the area, which are now privately owned compounding pharmacies, which really go out of their way to serve the community, are Freedom Pharmacy in Williston and Vermont Community Pharmacy in the North End. They are really excellent with their servicing.
Great. So, we've had a conversation. We've touched on recovery. That recovery resources are out there. Recovery sources are available to individuals. We've also touched on the fact that you can access Narcan. The fact that Safe Recovery is in operation. And if you are in the throes of an addiction, there is a needle exchange. You can also get low-barier buprenorphine. And then we had Dr. Bernstein really talk to us about anxiety and depression. And I think the message we pulled from there is that these are anxious times. There is going to be a level of anxiety. When you feel the anxiety having an impact on your daily life, having an impact on your sleep, having an impact with your partner, family members, loved ones, then it might be important to reach out and to access somebody to talk to. The same goes with feelings of depression and isolation. We have definitely been aware that there are many, many people in isolation with families, but there are just as many people who are in isolation as single individuals and are feeling incredibly frightened and depressed. And it's not just older individuals, it's also younger individuals. So I think that the message here is that you should reach out and talk to somebody, and that no feeling is a feeling that should not be addressed, and that there are professionals out there who can help individuals cope as they move forward. I also wanted to point out that we will be posting resources on the RRC website for folks to go to as they have questions. Another site that folks might want to be aware of is Vermont HelpLink, which is a site where folks can go if they are just wanting to talk to somebody about addiction services and outpatient versus residential, et cetera. I guess before I turn it back over to Anthony, I would ask our panel if there are any last minute thoughts you would like to give our community as we move forward in this period of unprecedented concern. So I guess, Gary, I'll start with you. If there's any last minute thoughts you would like to offer folks.
Yeah, I just, for all those folks that are in recovery from alcohol or drug addiction, I would encourage you to think of yourself as your own best friend. And what can you do to help yourself in recovery going forward? That concept is hard for you. If a friend calls you and is asked, what can I do? I'm struggling. I'm in recovery. I don't know what to do. I'm sure you have some great advice for them. And a lot of it will probably be, thank you for calling me so I can be of help to you. And that's what it's all about, is knit your own community together to support you and others as you go through this. There are formal organizations like the Turning Point Center of Chittenden County and my colleagues on the phone here, but we've got to kind of take it into our own hands, get that support, whatever it is, to keep you going in the right direction. And thank you for being here today.
Grace, last minute thoughts?
Yep, I just want to thank everybody for coming today. I want you to know that you're not alone at a time that can be very scary. At Howard Center Safe Recovery and other places, there's support for you. We support people unconditionally, so if you're struggling with using, or you're in recovery, or you're feeling like you might relapse or are relapsing, we just want you to reach out. You also might be experiencing new and different challenges. So I want to encourage people to call 211 also. The Vermont HelpLink is really great for substance use and recovery services, but 211 also helps with anything that might come up for you. You may not be used to dealing with unemployment. You might not be used to not having housing. The last thing is that at Safe Recovery, we see a lot of people who don't have housing. And I want you to know that there are places that people can go. If you call Economic Services or 211, you can get housed. And people really shouldn't be on the street right now. Everybody needs a safe place to be, and they are putting people into hotels. So I want you to know that recovery services are there, that we all are committed to working with people unconditionally through COVID, and that our staff didn't take a second to think about closing. We feel it's a privilege to stay open at a time like this. It's not easy for anybody, but that everybody's here to help and get people through this. So just know that this is a one day at a time situation, but that there's a ton of support out there, and you really have a menu of options to choose from our office to all different programs at Howard Center to Turning Point and other places. So really reach out. I think for people who that there are actually more options, that we've broadened options. Like Gary said, they're getting higher rates of people going to yoga. For some people, being in your home and getting support is actually going to make it easier and make it more accessible to you. So just know that this might feel different, but it might feel better. So just reach out in any way that you possibly can, and know that we're all here to answer that phone or that Zoom call, or at our office to provide you syringes and Narcan.
Great. Thank you, Grace. Dr. Bernstein, last minute thoughts?
A couple of thoughts. The first is the power of being heard. And this requires that those of us who are in the service portion of things pay extra attention to what people are meaning as well as what they are saying, because there's a tremendous amount of relief that comes to a person when he or she felt heard. The second is an old try and true mantra from AA, and that is that there is a higher power. We, as human beings, like to believe that we are in control of everything. We're not. And it can be very comforting to believe that there is a benign power, a benign something that is going to help us get through this. So I would say that the power of listening and the power of belief in something bigger than ourselves are tremendous healing vehicles, and I wish them on all of us.
Great. I want to turn it over to Anthony. Before I do, I want to thank our panelists for being here today. I also want to acknowledge our partners on the phone, our community members on the phone. I often say this in my work that I do, that in the world of opiate crisis, it is going to take a village. And I really do think that in the middle of a pandemic, it is going to take a village. Please, if you are feeling scared, alone, reach out and talk to somebody. We will include all of the contacts on the RRC site for folks to be able to go. But you are not alone. We are all feeling these feelings of being frightened. We are feeling these feelings of scared, the unknown. You are not alone. We are here to support you. We appreciate you spending time with us today, and we will have a variety of virtual town halls to move forward. So thank you for giving of your time today, and I wish everybody well. Anthony?
Thank you, Jackie, and thank all the panelists, Richard, Grace, and also Gary, for joining us. I'd like to thank all the listeners and the participants. Like Jackie said, we do plan on having many other town halls focused on many different topics. We also implore many of you folks that are here, or please reach out to people you may know that have ideas for future webinar topics. Please email us at recovery@burlingtonbt.gov, or you can call us at 802-755-7239, and be safe and be well.